Hello everyone. Today in series of DocPlex's KOL interviews, we have with us Dr. Sudhir Pillai, who is an ENT surgeon and a consultant at the Muhaisnah Polyclinic. He has a professional experience of more than 20 years and is extremely proficient in routine otolaryngology, head and neck surgeries. Thank you so much, Doctor, for this interview. We would love to hear some of your opinions on a variety of topics. Let me start by asking you some questions that would greatly benefit our listeners.
My pleasure. Okay.
What are the recent advances, in your opinion, in otorhinolaryngology?
I should tell the most innovative ones, or one that has benefited mankind a lot, is the cochlear implants. It has come a long way, and children or persons who never had the ability to hear or have lost their sense of hearing. So when you use this cochlear implant, and if you give them proper training, they have started hearing. That's I think one of the blessings of this century.
That is truly wonderful. And now to talk more about other disorders, how prevalent are ontological disorders in diabetes patients, and what are the management approaches for the same?
First of all, diabetes, as you know, is type 1, type 2, like that. One, how does it manifest to the humans? One, long-standing, the sensory nerves, that is the auditory nerves, they get damaged by the long-standing effects of the sugar in your blood. So slowly you start getting sensory neural deafness. And one other thing, there'll be progressive loss in hearing, and it will go on like that. And eventually, when you, after 30 years, you will become totally deaf. And the other one is the frequent attacks of infections that you get. That's more common in children and also in older people. And as you know, the infection will naturally destroy all the ossicles. It can cause labyrinthitis. Then when you get labyrinthitis, there's no chance for getting back your hearing. That's one of the major complications of diabetes here.
And in your opinion, what is the effect of diabetes on hearing in particular and on cochlear structures?
One, as I've already told, the long-standing diabetes will injure your auditory nerves. This causes progressive hearing loss, sensory neural hearing loss. The other effects, as I told, the frequent infections. This will destroy the ossicles. It will cause a lot of complications: mastitis, labyrinthitis, facial palsy, meningitis. You can attack almost all structures in the brain also.
And now to talk more about type 1 diabetes, what, in your expert opinion, is the association of type 1 diabetes mellitus with auditory dysfunction, and how can we best manage it?
Type 1 diabetes, the type 1 usually manifests in children, and they get frequent attacks of otological infections, ear infections, and usually they get severe infections and associated with major complications. One of the major ones is the mastitis, and meningitis. That's and sinus thrombophlebitis. That's a common.
And now to talk more about digitalization taking place in online platforms, we would love to hear your opinion about DocPlexus and how platforms like that help spread awareness about various disorders.
One of the things you keep, keep in contact with your colleagues, with your subject. You can put forward your doubts. You get opinions from your colleagues. You can manage cases better.
That is wonderful, Doctor. Thank you so much for providing such invaluable insights. I'm very sure our community is going to greatly look forward to hearing them. Thank you.
Okay, thank you.